Alison, let's get another point of view on this topic from Tracy Norris.
My simplistic theory is that if you want to work hard and achieve things, you vote Liberal. If you want to sit around and wait for handouts, you vote Labor. Labor used to be... Labor used to be for the benefits of the workers. So why are recent and current Labor governments penalising those very people by introducing legislation such as reducing their private health fund rebates?
Jenny McAllister.
It does sound like one for me, doesn't it?
Oh, damn!
Look, it is absolutely the case that Labor Party members, and of course I'm not a member of the government, I'm a representative of party members, but what party members want to see from their governments is absolutely a commitment to helping working people and to helping not just the very disadvantaged, but the vast bulk of people who work pretty hard, don't ask for much, but do need some certain things secured in their life. And that includes availability of healthcare, availability of a good education, and the knowledge that, if things go bad in your workplace or in some terrible way in your family, there might be some backup for you financially. And I think they're core ideas for us. If you look at what is actually on the table in terms of the health proposals, what is being suggested is that people who earn more, families that earn more than $250,000 a year, might not need subsidies from those people who earn considerably less, and it's worth noting that that's the vast majority of the Australian population. If you earn more than $250,000 a year in your family, maybe you don't need a handout.
Can I just say though, can I ask a question on that? If that philosophy were taken to its logical conclusion, then why don't we means test Medicare?
Yes.
Can I? Oh, well, I don't want to cut across you, Robert, but I mean, I think the question about Medicare is that it is a basic safety net. It is there for all Australians. But it
still ultimately involves people, even if they have private health insurance, that go to a public hospital, are still subsidised. Wealthy people who could otherwise buy their way out of the system, if what you're arguing is consistent, are still paying for those who are wealthy.
That's certainly the case, but one of the benefits, of course, is that when you've got a Medicare system that everyone accesses, there is whole of society buy-in. Everyone's committed to it. Everyone wants to see it work well.
And in fact, both sides of politics do not want to dismantle Medicare. I think you're out on your own there.
No, it's not It's not dismantling Medicare. But if you're going to
you're philosophically opposed to it, aren't you?
No, I'm philosophically in favour of a system of universal health care that's different from the current structure. We can go through individual accounts and talk about it if you want, but it's not about dismantling Medicare.
Let's hear from
I want to make a distinction which is never made, but I think is very important. I don't think we should talk about middle-class welfare. I think we should talk mainly about upper middle-class welfare. And in fact, I find it absolutely both ridiculous and grotesque that subsidies are given to people over $250,000 income. None of those people are going to rely on the public health system, and the argument falls there. Again, I find it grotesque that very wealthy private schools are given large amounts of upper middle class welfare. And the reason I say this is not because I'm full of class envy or whatever, as will be said by the right. The reason is that we are in a country where at least 3 categories of people are in dire need of a real welfare state, which I disliked your attitude very much. The 3 kinds of things we could do: firstly, disability insurance, which people are getting close to but fearing; dental care for working class and unemployed people and so on, and huge amounts need to be paid for mental health. And we live in such a prosperous country, but families, middle-class, working-class families in these areas are really suffering. And in my view, the welfare state isn't complete, and there are these very important gaps. And so the idea that there are subsidies going to people over $250,000 for health insurance, or very wealthy schools are getting subsidies, seems to me utterly unconscionable.
I'll just throw something to Jenny McAllister, because it isn't just about subsidies in this case, it's about penalties. And under the system being proposed here, a family earning $166,000 will face a very serious tax penalty of $3,500 if they leave private health insurance. So there is a carrot and stick approach. It's quite a big stick for a family earning $166,000. There are quite a lot of families in that income category.
And look, I think that the government, and of course, I'm not the health minister, but I think the government, of course, sees a role for private health insurance. There's kind of a settlement around this, that we do see that the private system, you know, intersects in positive ways with the public system, and that those penalties, unlike the subsidy for private health insurance, those penalties have been very effective in driving levels of private cover up higher and higher over the recent years.
So is that the way Labor's going now, to a bigger stick and no carrot?
Oh, please don't. No. The carrot will stay. She's still in power.
Well, I don't think you can say that there's no carrot. I mean, very large numbers of people will still have access to the subsidy, just not families that earn over $250,000 a year.
Okay, I'll come to you in a minute, Helen, but we do have another question it's related to this. It's from Jennifer Lee.
Hi. As a university student who earned over $18,500 in the 2 years since I left high school, I currently receive youth allowance payments from the federal government. This is just one example of welfare payments that are means tested to allow for fair allocation of resources. Is the government's proposal to means test the private health insurance rebate really that bad?
Helen Kroger.
Look, thank you for that. And I actually think it brings into the whole arena a bigger issue, and individuals have touched on it, and that is what this is engendering, I feel, in the debate now is class warfare. It's really bringing back the very divisive argument about the haves and the have-nots.
Because how does what that young lady just said represent class warfare? Because she's actually saying she went out and earned this money so she can be eligible for this subsidy. Is that class warfare?
No, not in that instance. But with the youth allowance that you have been able to access, I might say that the Labor government tried to pare that back, and it was the coalition that defended those that live in country and regional areas so that they could access the same level of youth allowance that city students could. It's means tested, but you wouldn't pay any tax on that. You wouldn't pay any tax on that level. So I don't think we're comparing lights here. I've got to ask you, the question in principle was about means testing, about the very idea of means testing as a matter of principle. Do you think that all students... Well, it's been tested on the basis...
Do you think it should be not means tested, so that all students should get this allowance, no matter their income?
No. It's being means tested so that if you have a capacity to earn $30,000, $40,000, $50,000, it is means tested on that basis.
I think the purpose of this particular means test is to make sure that this person is on their own, that they aren't being supported by a rich family.
Oh, totally. And with good reason. If I can come back, though, to the private health insurance issue...
But just quickly, means testing is OK in this case, is it?
Well, I think we have means tests across a whole lot of platforms. And the government introduced means testing for youth allowance just for that, for the purpose that they were not... didn't have the opportunity to be supported by wealthy families. So, yes, that's the case. My concern about the approach with the private health insurance rebate is that you are essentially saying, if you are prepared to invest in your own future, if you are prepared to invest in your own health, which takes you out of the public hospital system, then you will be penalised.
If you can afford it, though. If you can afford it. If you're making more than $250,000 a year, you can afford it.
But, Robbie, you keep talking about people earning $250,000 a year. We're actually talking about different thresholds than that. And there are many couples where there's a policeman and a teacher in the family that would reach the threshold of $166,000 that work very hard to make ends meet, who would not consider themselves to be wealthy enough to pay a penalty of $3,500.
OK, Helen, let's hear the rest of the panel on this briefly. Mikey.
I think I've said it before. I think the problem is the word mean. It just sounds ugly, means testing. But if you can afford private health care and there is no loss to the public health system, I think it's a worthwhile thing to do.
Jenny McAllister.
I think you're always looking at the balance of resources. You know, you've got a budget that's got a certain level and you've got to decide the places where you're going to target a universal system are the places where you can only provide targeted assistance to the people who need it the most. I think in a situation where we've got limited means, providing big subsidies to families who really are doing okay. They might not be rich, but they really don't need that much extra help at the moment.
Tim Wilson, is means testing a logical way to allocate resources?
Yes, it is, but I think before we worry about means testing private health insurance, we should means test other giant subsidies like the automotive car industry and to other major industries like aluminium that suck billions of dollars of public resources to prop up their profits. And I don't understand how the ALP can turn around to individuals and say, Australian individuals, you can't have money, and then say, but by the way, multinational car companies who make profits overseas can.
Robert Mann.
We can pursue this.
Philosophically, I'm absolutely in favour of means testing, but I'd like to make another point. I'm interested in ideas. At the end of the Second World War, countries like ours in the United States, Britain, were taxing at 80–90% for the high-income earners. Now they're taxing far less for the 1% or the 0.1% of the population, and whenever, particularly in the States, but also here, the slightest move is made to bring about some kind of equity in the taxation system, we talk about this class warfare. It's an absurdity. The wealthy find ways of defending their wealth, and that's what